we're going to have a discussion focusing on MDS and anemia in lower risk MDS. I am Hana Safah, Professor of Clinical Medicine at Tulane School of Medicine, as well as the Director of Stem Cell Transplant and the Heme Malignancy Program at Tulane. Joining me are my colleagues.
Hi, I'm Jamile Shammo. I'm Professor of Medicine and Director of Bone Marrow Failure Program at Northwestern University.
Hi, I'm Andrew Brunner. I'm an Assistant Professor at Massachusetts General Hospital and Harvard Medical School in Boston, Massachusetts.
Hi, I'm Tiffany Tanaka. I'm an Associate Professor for the Division of Blood and Marrow Transplant at UC San Diego Moores Cancer Center.
To start our discussion, I'm going to go with an overview about myelodysplastic syndrome that is now being also recognized as a myeloid neoplasm by the WHO. Myelodysplastic syndrome is an acquired disease where patients' bone marrow usually show evidence of dysplasia, ineffective erythropoiesis, resulting in cytopenias. And when we speak about cytopenias, we're talking about leukopenia, anemia, and thrombocytopenia. Patients usually present with different phenotypes of the disease. So it's a heterogeneous group of disease as such. Usually at presentation, we make the diagnosis by bone marrow biopsies, doing the karyotyping and molecular studies. And it's becoming very important to do the molecular studies early on to detect all these genetic mutations and alterations that can affect the classification of the disease. Patients with MDS, when they present with the cytopenias, usually need what we call supportive therapy for the cytopenias related to disease, whether the anemia or the leukopenia or thrombocytopenia. However, if they have a higher risk disease, or what we call intermediate to or high risk disease, we do treat these patients with HMAs. Having said that, we know at this point that there is no curative treatment other than bone marrow transplantation. So some patients need to be referred to stem cell transplant program to be evaluated for stem cell transplant. When we talk about patients with MDS, we're talking about elderly population. The median age is around 71 years of age. And when we focus on patients with low-risk disease, we're focusing on, according to the IPSS-R or the revised IPSS, these are patients who have very low risk, and intermediate. And these patients usually have an expectation, an overall survival, a median overall survival of 5 to 6 years. And they usually comprise the majority of the patients in our clinical practice. 77% of the patients are usually at presentation belong to the low-risk MDS. Having said all that, the long median overall survival, talking about the anemia in that elderly population with a median age of 71 years of age, anemia becomes a chronic disease in these patients who usually suffer from multiple other diseases and other comorbidities. And as such, they end up with decreased quality of life and complications from the transfusion if they become transfusion dependent. And the expectation is that 40% of patients who present with anemia are going to end up with the need for transfusion or transfusion dependent. And these patients not only suffer from shortened overall survival to start with, but as I said, the need for transfusion does add a burden on their health and quality of life.